And welcome back to Life Unrehearsed. I'm Matt Del Vecchio, specializing in life transitions, elder care planning, and the senior living industry. You know, as our population ages, care needs increase, and we are clearly seeing that our existing healthcare system is not able to effectively manage these escalating needs. Is it time for a mixed healthcare system? Should we be increasing private sector assets to support the public sector, similar to systems in France and Sweden? Well, we have the editor-in-chief of The Suburban, Beryl Wajsman, in studio with me to debate this very hot topic. Beryl, thanks for joining me here on Life Unrehearsed.
Thanks for the invitation.
All right, you recently had a wonderful editorial in The Suburban, Beryl, on this exact topic. We know the healthcare system's extremely fragile, in shambles, some would say. So is the system broken, especially as our population ages?
Matt, the new Chief Justice of the Superior Court of Quebec, Marianne Paquette, said last week that the justice system is being held together by duct tape. The medical system is being held together by Scotch tape. It's past broken between government greed and the I want to say this carefully, the attitudes of a great majority of doctors. The medical system, as far as the hospitals are concerned, are being held together. Believe it or not, the unsung heroes are the director generals, the executive directors, who are trying to meld all this together. Mm-hmm. It definitely needs support from a private sector alternative. Mm-hmm. The government's recognized that. Premier Legault has said it, and we'll see what's going to be done about it.
You know, I'm going to throw you a big fat lob ball here, Beryl, because I know how you feel about this, but is government bureaucracy part of the problem?
Okay, so government bureaucracy is a huge part of the problem. I'm going to ask your listeners' indulgence, and I'm going to ask them to take a pen or a pencil and take some notes, so the next time they see their M&As, they can throw this back at them in bullet form. So there's macro issue. There's one big macro issue, and there's several issues, 5 issues, that can be addressed to be fixed now to alleviate the problem. You spend your professional life, particularly with a concern for seniors, for example. Mm-hmm. Did you know that 67% of the people in our hospitals today in Montreal are geriatrics, that age and up? So we have a problem in Quebec, not of lack of resources, but of the politicization and weaponization of the Medicare system. And that's not much different than any other jurisdiction. And what do I mean by that? Medicare was never meant to allow government to set policy to expand hospitals or reduce hospitals, to eliminate hospitals. Medicare was supposed to be, when it was introduced nationally, a compassionate, necessary, needed insurance plan, like EI, so that no family and no person will go bankrupt facing traumatic illness. From 68 to 75, every province wanted to grab power over health policy. Remember, Quebec didn't even have a health ministry till 1960. They did so, and they dictated to the hospitals everything they're supposed to do. So what's our problem in Quebec right now? 39 cents of every dollar of our taxes, 39 cents, goes to the health ministry. But of that, over 50% goes to pay people, I'm going to say this slowly, with no connection to the delivery of medical care. They are bureaucrats set up by one government after another for political control of the system to make it an issue, and they're all unionized. This number is the highest percentage in any Western jurisdiction ever, except France in the late 90s. And President Chirac in France took drastic measures. He also had a massively bloated, unionized bureaucracy in healthcare. I think they got up to 57%. He declared a state of national emergency. He cut the power of the unions under that law, cut the bureaucrats from 57% to 36%, redirected money for the expansion of hospitals, buying equipment, returning power to the hospital administrators, and gave doctors a cap of 15% of their time that they give to the national system, they could do clinique privée. After 7 years, France is considered to be the second best medical system in the West after Israel's for efficiency and delivery. What is our problem in Quebec in doing that? Quebec is only one of 5 jurisdictions in the world. We're one of 4 in the Western world. We're one out of every 4 people work for the government, and they are unionized. Both are the highest rates. No government in Quebec will take the political chance of losing those votes by doing what Chirac did. Still, there are things they could do.
Yeah. And very, very clear that bureaucracy is part of it. I see it every day. I see the people struggling in the CSs and CLSCs. And you know what? It's not even some of the employees they are just as frustrated. Now, we're talking with Beryl Wajsman here about the state of our healthcare system. And is it time, perhaps, to get a mixed healthcare system? And Beryl, you talked about France. I want, just for context here, because it could be confusing, explain to us some of the, a proponent of, say, a France or a Swedish healthcare system, which seems to have some validity, something we should be looking at, versus, let's say, a U.S.-style healthcare system. What, big picture, what's the difference between those types?
There's a whole misunderstanding of what the U.S. system is. And I want to go through just three more points that Quebec can do, and they have to do. We have to do it, even if we have a mixed healthcare system. So number one, and a lot of people don't understand this. First of all, if you cut the bureaucracy, you're returning money to the hospitals, but the hospitals have to administer it, not the government. The government has to stop telling doctors where they can practice, this whole PREM system, which has caused a drain out of Quebec. We're not keeping up with replacement doctors. But number three, believe it or not, part of the problem is also the doctors. In Canada, doctors are called independent agents. They're paid by the government. They're not paid by the institution they serve. So the director generals cannot tell them what to do. They can't institute a system where the medicine follows the patient because the doctors decide their hours. So you go in with a problem. It's like going into law office. Let's say you have a business problem. You go to your lawyer. Then your lawyer at his office will call in a tax expert, a securities act. There's different elements, but he is seized of your file, as it's called. That doesn't exist in medicine. So you go to ER, you're seen by a doctor, and they're off. And then the next guy you're a part of a division. So you could be cardiology, you could be oncology, but who's treating you? Nobody knows. And the hospital can't tell the doctors because they're independent agents. In America, 70% of all doctors are employees of the institutions they work at. And the county hospitals are, people have this impression that America's all private. It's not. There is it's already a mixed use, not in the same way we're talking about, but the county hospitals don't turn people away. The quality of care is not as good, clearly. So before we even start going into boosting our private alternatives, we have to clear up this mess, which the government can do. This doesn't involve confrontations with unions. This doesn't involve confrontations with anybody. This means redirecting money, stop politicizing the issue, and give the resources to the other sectors. Now, people have this impression that mixed healthcare means, oh, God, there'll be a drain. When we're talking about mixed healthcare, we're talking about increasing the amount of clinics where certain procedures can be done, and most of those procedures can be covered by Medicare. Some will not be. There will be a deductible. So, for instance, we have Rockland MD that does orthopedics. Well, there are other disciplines where we can have private clinics like that.
And can expand on that, absolutely. And we want to talk a little bit more. In fact, we want to hear from your listeners. We have to head out to traffic, Beryl, but please, we would love to get your input. We're going to open up the lines for you. So if you want to call in to 514-790-0800, 514-790-0800, or you could text us at 514-800. We want to hear from you. But first, let's hear from the CJD Traffic Center and Jill Fitzgerald. I'm Matt Del Vecchio, and I'm talking with the editor-in-chief of The Suburban, Beryl Wajsman. He recently wrote an editorial that generated a lot of feedback, and it was about whether it is time for a mixed healthcare system in Quebec and in the country. Should we be increasing private sector assets to support the public sector, similar to systems in France and Sweden? And we want to hear from you. There was a lot of texts in. They're coming in. Just to repeat the numbers, you can text us at 514-800. 800, or feel free to call us at 514-790-0800, 514-790-0800. We want to hear from you. Are we ready for a mixed healthcare system? Beryl, all right, we're going to pick it up again. And you put this post about coming on the air on Facebook earlier on, and tons of comments.
All the platforms.
Yeah, it's all the social media. That's right. We're talking with Beryl here.
That was a great intro song, "Blown in the Wind." Yeah. Hopefully, somebody listened to just to the words of that.
Listen to the words is right. Like my wife for taking that one out. Very appropriate. So do you think there's an appetite in Quebec to implement a mixed healthcare system, Beryl?
Ipsos poll conducted for the Montreal Economic Institute several weeks ago showed 73% of Quebecers are ready for a mixed care system. Everybody's had people die. Everybody's, either themselves or with their friends or with their family, have sat 15 hours in ERs. They understand, without knowing the details, people understand that whatever the politicization of healthcare everywhere in this country is clear. They don't quite understand what they're doing. They didn't get into the details. That's why I prefaced my remarks in the last block by saying people should take these notes, because this is what the government can do if it has the political will to do it.
That's the key point here, is the political will. Beryl, the lines are lighting up here, so we're going to get to some listeners. We're going to hear from Nick. Are you there, Nick?
Yes, I am.
You're on.
I'll tell you a little story. There's absolutely something wrong with this health system that we have right now, because I went to the Jewish General for a particular health issue. I waited there for 9 hours. I saw the emergency doctor, and I thought he was going to give me x-rays. That's part of the reason I went there. But he said, move like this, move like that, and a prescription of Tylenol, and there we go. Problem solved. But the problem wasn't really solved, because he didn't check the second problem. He asked if I had a family doctor. I said no. He said, well, you need a family doctor. We can't do everything here today. So I leave there. I go to Rockland MD the following week, and everything that was done, $640 later, blood tests, everything done, x-rays across the street, all within an hour.
Amazing.
So
Nick,
something's absolutely wrong.
Thank you. And you mentioned Rockland MD,
yes,
too.
And Nick, I have more depressing news for you. The Jewish General is one of the centers of excellence in the country, so you can imagine the rest of them. But yeah.
All right. Nick, thanks for calling in. We're going to head out and hear from John. John, are you there?
Yes, hi there. I went to the SHRM for a stress test, and I had to do a follow-up a short time later at the Montreal General, and the cardiologist at the Montreal General told me he cannot access my file because the SHRM and the Montreal General are not on the same system.
That's correct. It's another
which
problem.
is insane.
It is totally
I called
insane.
up my M&A and I asked, what is the reason for this? I thought in Quebec, everybody works in unison.
No, they don't. I don't want to name a name, but a director general of a major hospital complex has been lobbying for a unified information data flow, at least on the English side, for 4 years. This is not complicated. The whole program would cost $400,000. It has not been implemented. This is a major problem because the CAC government has introduced a new bill. I'm going to get the number wrong, but they've introduced a whole bunch of bills the past week. I think this is Bill 4 or 11. No, 4 was the oath on the monarchy. This bill is aimed at digitalizing all patient information and making it accessible directly to the patient and to any doctor. It's not passed yet. I don't know what technology they're using, but you're quite right. That problem of information flow is a horrible one.
Crucial. Rex, thank you John, thank you for calling in. Rex, you are next. Are you there, Rex?
Hello.
Hi, Rex.
Hello, everybody. Thank you for taking my call. Okay, I didn't even know where to start. This is like 3 years.
Neither did I.
You have about a minute here, Rex.
Okay. Verdun General. I had a terrible accident 3 years ago with my foot. Turned backwards, my ankle. I went there against my will. I wanted to go to MGH, which is up the hill. I live in the McGill Ghetto. It's 2.5 minutes by ambulance. Okay? They said, no. We have 2 orthopedic surgeons because of COVID, blah, blah, blah. You're not going to get taken care of. It's too full. We're going to take you there. Well,
Who told you? Who told you this, Rex? Who told you they wouldn't take
now
you?
I'm crippled. I can't walk. I got really screwed around. I mean,
Rex,
every time. I was denied pain medication because of the stigma, because of opioid stigma, blah blah blah.
Yeah. Rex, go back a step. Who told you? Who refused to take you to the Montreal General? Was it the emergency? Was it the emergency paramedics, or was it how did you end up in Verdun if you live in the McGill Ghetto?
Okay, when the accident happened,
yeah,
it happened just up the street of my. I'm living on Lorne Avenue. It happened like 100 yards away from my house. So my friend put me in his truck. He just happened to be. We've had a lucky thing. He was across the street, took me to my house, backed up down the street, brought me into my kitchen, which put my foot in a bucket of water. Every ice cube I put into the bucket and sucked it in. Then I waited 45 minutes for the ambulances to arrive. Then when they came, I said, I want to go to MGH, just up the hill. Just up the hill, you know. I mean, it's like 2.5 minutes. No, they're full because of COVID, blah, blah, blah. We have it's on our screen.
This is a common problem. Unfortunately, we don't have the time for me to explain to the listeners exactly why it's a sham. It's not true, and it's something that Urgence Santé really's got to fix within themselves.
We hear that all the time. Rex, thank you very much. All right, we got to wrap it up there. So we're sorry for all those that are waiting. Beryl, last word goes to you. Are we ready for
we are ready for it. We need it, but we need the other changes by the government. We need to free up, get rid of this PREM system that tells doctors where to go. We need to get rid of the power of the Collège des Médecins that's not letting hundreds of foreign-trained doctors write the medical boards. It could solve our family doctor shortage. We've got to give power to the directors of hospitals over their doctors who are independent agents, and they cannot be told when and where. We need all that, because if we don't do that, yes, expansion of private facilities is necessary, but we still have to concentrate on the other. And I want to leave your listeners with one simple thought, a shocking thing. I am not overstating it. You can all check it. There is no other nation on the planet, and I'm not talking about the industrialized world, on the planet, that has such a centralized statist medical system as Canada's, except for one. And that country is North Korea.
Kind of scary. Beryl Wajsman, thank you for coming in here. I think we are going to have to continue this discussion. The appetite is there from the general population. We obviously have to do things. Everyone could relate to a family member or themselves where it is in shambles, our healthcare system, and things need to start happening. Beryl, first thing you said is talk to your M&As, and it's got to start somewhere. Just don't stay quiet here. Thank you very much, Beryl, for joining us here on Life Unrehearsed.
Thank you for having me.
That's Editor-in-Chief of The Suburban, Beryl Wajsman. Thank you very much for tuning into Life Unrehearsed. As a reminder, for all your inquiries or assistance with life transitions, elder care planning, and the senior living industry, be my pleasure to help. Call me at Lianas Senior Transition Support. That's 514-622-8074. Or simply look me up under Lianas Senior Transition Support. Many thanks to our technical producer, Dan, and we had Dean on the board for the first time. Thank you, Dean. You can listen to Life Unrehearsed here on CJD 800 every Saturday at 3 p.m.